Hello, folks. Welcome to your last lesson of the semester. I apologize for not being able to be there in person due to personal circumstances. That's the case that happened. Today's last lesson is Introduction to the Clinical Laboratory, some of which you may have had in previous classes, some of this you may have at a future time. But it's very important to understand the concepts of this video. So why are we performing laboratory tests? Well, why are we doing blood draws? Why are we doing nasal swabs? Why are we examining urinalysis? Well, four main purposes. One, to document the good health of a patient. Sometimes this just becomes part of their routine medical care, like checking for cholesterol or checking for kidney functions, to screen patients for diseases such as diabetes, high cholesterol, or urinary tract infections so we can manage these diseases, to help provide diagnosis or help the provider diagnose a medical disease, disorder, or condition, like blood work for cardiac enzymes to see if this person's actually having a myocardial infarction, or maybe different types of more advanced blood work to see if a patient has certain type of cancers, or simple throat swab just to see if they have um, strep throat or mononucleosis. Help the provider decide the most appropriate treatment and monitor the effects of these treatments. So let's go with a little question and answer here, and it looks like I already have the answer keyed up there. The act passed by Congress to establish quality standards for all laboratory tests is known as, well, as it says here, CLIA, Clinical Laboratory Improvement Amendment. And that's a term that you want to be familiar with. There will be some questions about that on your CCMA certification exam. So the Clinical Laboratory Improvement Amendment helped provide stability and uniform standards of all clinical laboratories across all 50 states in the country. This is a blank screen, probably a video that won't show up here. What is a CLIA number? It's basically a designation code to say that these tests have met the standards. Which of the following is not a responsibility of the medical assistant in the clinical laboratory? So is A, providing proper patient preparation? B, interpreting abnormal results and providing patients with diagnoses? C, develop a knowledge of analyte normal range of results. Now, analyte is what we study in the test, like sodium or electrolyte panel or lipid panels. And D, obtaining and labeling specimen. So think about it for a second, and if you thought about it, you'd probably know that the correct answer is B. The medical assistant is not permitted to interpret abnormal lab results and providing patient with diagnosis. That is beyond the medical assistant's scope of practice. Let's look at this. What is the term defined as a substance or chemical being analyzed or detected in a specimen? And we actually just mentioned that. So is it aliquot, analyte, aspirate, or exudate? The answer is an analyte. So here's an example of some analytes, some electrolytes, and their relative normal values. I mean, you're not going to know the normal values of every single analyte you draw, but over time, you tend to get a pickup and a feel for what's normal and what's abnormal. The aliquot is the amount of specimen that's drawn, whether it be the urine remaining in a cup or the actual blood that's drawn into the tube. Aspirate is some type of suctioned out fluid, body fluid, like nasal secretions and things like that. And exudate is just an effective mass of fluid. So a portion of a well-mixed sample that is removed for testing is called, and that's what we said before, the aliquot. So sometimes that includes the sample that we're drawing plus whatever additives have been put in that sample, such as an anticoagulant or a preservative or a serum separator. A laboratory department that studies bacteria, fungi, yeast, parasites, and viruses. Give you a minute to think about that. And that would be your microbiology lab that looks at all of these little microorganisms. So, for example, if you take a urinalysis from a patient, in the office, you can see evidence of a urinary tract infection, but to really isolate what organism is causing it, it has to be sent out in a culture to the lab, and that lab is usually the microbiology lab. A chemistry lab will will look at analytes such as your electrolytes, your kidney functions, your liver functions. A histology lab is where they look at certain tissue samples for presence of cancer cells. And hematology is a study of blood, red blood cells, white blood cells, platelets, and so on. So the microscopic analysis of cells is the science of, as I said in the previous slide, histology. Sorry, cytology. My fault. And a technician that performs these tests is called a cytotechnologist. They have to look at numerous specimens over very short periods of time and really make the determination if this cell type is cancerous or non-cancerous. And they are under a lot of pressure to do that, um, multiple specimens. The clinical chemistry department performs which of the following tests? Does it look for the presence of ketones in urine? Does it look for cell morphology? Does it look at blood cell count, or does it look at the lipid profile? 10, 9, 8, 7, 6, 5, 4, 3, 2. It looks at the lipid profile. Lipid profile is the amount of cholesterol and triglycerides that you have floating around in your body. Presence of ketones in the urine can be done right in the office. Cell morphology, or the shape and type of cells, is a part of the cytotechnology that we talked about. And a blood cell count is examined in the hematology department. Which department of the laboratory analyzes blood, cerebrospinal fluid, urine, and joint fluid? That would be the chemistry department. Now, I said you might confuse the chemistry with hematology. We didn't say examining the components of blood, the red blood cells, the white blood cells, the platelets, and so on. We said the blood itself, the blood as a sample to be examined. So an example of one test we would do on blood would be a comprehensive metabolic panel. Measures 14 different substances in the blood to check the levels and for normal and abnormal results, like glucose levels, sodium levels, potassium levels. This is not stuff that we're going to be examining ourselves in the sample, but we do want to be able to tell our patients what the doctor is looking for and how important these components are to their overall health. So I mentioned this before. Culture and sensitivity test is most likely to be performed in which division of the clinical laboratory? Well, to answer that question, you need to kind of know what a culture and sensitivity is. So maybe you've gone to the doctor's office with a sore throat and they did a little swab in your throat to check for strep throat. And you may see that they actually did two little swabs. One goes into the point of care CLIA waived a rapid strep test, and that looks for antigens or little proteins that are consistent with streptococcal infection. These tests are not 100% accurate. It's about 1 in 5. So if the patient's condition warrants this, that second swab will be put into a little sterile medium and it'll be sent out to the lab, and where they'll examine it over 48 to 72 hours to see if there indeed is strep bacteria, and also to see what kind of antibiotics will take care of it, as opposed to what antibiotics this organism might be resistant to. And if you haven't guessed the answer to this question already, it's the microbiology department. So you can see right here is they put a sample of the bacteria in a certain medium. This is called blood agar. They basically take the swab, scrape around a little time, give it a little time for that bacteria to grow in a process they call inoculation. And you can see the sensitivity chart here to common antibiotics. Levofloxacin will work pretty good. Gentamicin will work better. Ceftriaxone will work great. Amikacin, ciprofloxacin, not so much. So that's why we do those type of tests. Right, so let's move on. Categories of tests performed in this clinical laboratory assigned by the FDA on the basis of the what? So yes, if you have a CLIA waived test, in other words, a test that can be done in office, Without the lab, we have to assess the potential risk to public health. So most of the lab tests we do are of minimal risk. Throat swabs, urinalysis, blood draws. Obviously, excuse me, we're not going to be doing spinal taps in most outpatient settings. It's just too risky. Laboratory tests performed in a physician's office are most likely to be categorized as CLIA, Clinical Lab Improvements Amendment, waived, and up to minimal to moderate complexity. Okay, something high complexity will not be CLI waived and beyond the scope of the medical assistant. And this is just a table of some examples, like a dipstick tablet reagent urinalysis to screen for assess for different types of situations like diabetes, kidney disease, urinary tract infection. I might have mentioned in either this class or other classes, a simple point of care urinalysis can give a provider a lot of information if they know what to do with it. And fecal occult blood tests can be an early indicator of cancer in the colon. Spun microhematocrit can measure red cells, screen for certain types of anemia, and just the list goes on. So what are moderate and high complexity tests? Okay, laboratories that perform these tests must meet CLIA regulations subject to unannounced inspections every 2 years. Usually they don't come announced, but that's why you really need to be on top of things like maintenance, calibration, proper supplies. So it must establish a system to maintain integrity and identification of patient specimens throughout testing process to ensure accurate reporting of results. It's been a common theme over and over and over again. There is almost no greater medical error than to misidentify a patient. The results could be catastrophic. So which of the following is not a CLIA wave test, something that you would not do in the office? And the answer would be gram staining. That's usually something that's done at the lab itself. It's where they take a certain sample, smear it on a slide, and add some different types of dyes to differentiate general what type of bacteria we're looking at. Gram positive versus gram negative. These different types of and then there's subdivisions of bacteria after that, but that can give us a quick idea of what type of pathogens we're dealing with until further testing can be done to identify the most specific bacteria. Medical assistants can perform all CLIA wave tests and some specific moderate complexity tests. Okay, but some require additional training and to be formed for moderate complexity tests, depending on the certification of the person of lab where they work. Although medical assistants cannot perform high complexity tests, they can be involved in patient preparation, providing direct patient education, specimen collection, and documenting results in the patient's health records. So if you're working in a specialty office, they're doing some type of specialty test. For example, maybe a hematologist office and they're doing a bone marrow biopsy. That's a pretty complicated process. The hematologist will have to numb the area and basically drill a little hole inside the back of the patient's sacrum or around their pelvis to draw out a little bit of bone marrow. It's a very complex process. So they may have to give you additional training of how to prepare all the equipment and how to handle it once it's drawn. Most common specimens collected for laboratory testing in our area usually include what? Usually include blood and urine and swab samples from wounds or mucous membranes. Those are the most common outpatient labs that the medical assistant will be responsible for obtaining and processing. The pledge of healthcare professionals to work to achieve the highest degree of excellence in the care given to every patient, otherwise known as quality assurance. Quality involves things like analyzing or reducing errors before the specimen is drawn, when the specimen is processed, and when the specimen results are reported. So which of the choices below encompasses a comprehensive set of policies and procedures developed to ensure the reliability of laboratory results? And if we look at the choices, you may say A, B, C, D. That's also, again, called quality assurance. So there are three stages of quality assurance in the laboratory that I alluded to earlier. And first is the pre-analytic stage. The provider orders a test screen, monitor, or diagnose a patient's condition. Well, that all really depends on the provider's competence. You got to know what he's looking for and what to order. A written or electronic requisition is filled out, so basically a prescription or an order showing the test requested, the specimen required, and where the specimen will be tested. Will it be tested in-house in the office, or will it be sent to an appropriate lab, like Quest or LabCorp? Specimen is collected, labeled, and processed, and then it is transported to the laboratory and properly presented for off-site laboratory pickup. And now, if any of these factors are messed up or are not carried about properly, then we have what's called a pre-analytic error, and that's on us. That's on us in the medical office. Obviously, if the provider orders the wrong test, that's on the provider. But if there's a patient misidentification or if there's an error in the physical obtaining of the test, that's on the medical assistant. If there's a delay in getting this thing shipped out to the lab, a lengthy amount of time, or improper packaging, if something needs to go in ice or stay out of light, that's on us. In the analytics stage, this is where the instruments are maintained and calibrated, controls are run and analyzed for each test method, part of ongoing quality control. Specimen is tested and results and compared with reference ranges. The test results are logged and documented in the patient's health record. So what could go wrong here? Well, if it's sent out to the lab, it's really out of our hands, but there are criteria for doing point of care in-house labs where there are a lot of situations for error. If the instruments themselves are not calibrated properly, or not maintained, or dysfunctional. If the controls are not analyzed for each test method, if they're not constantly maintained. If the specimen tested is basically compared to a different type of reference chart, and again, if it's not logged properly. In the post-analytic stage, the big problem here is the provider interpreting the results and treating appropriately. That's really out of your hands as the medical assistant, but you should identify what that is. So before a laboratory test can be used for patient samples, quality control must run to ensure that the test is considered reliable. So when we use the term accuracy and precision, accuracy is a measure of how close a test result is to the true value of a control material as established by the manufacturer. Precise is the ability to consistently reproduce the test results. Specimen labels should include one of the following except patient's address. That is not a criteria for sending out a lab specimen. So this is just a diagram of some little hints and prompts to keep you safe in the laboratory. It's basically showing you standardized placards of when there's hazardous materials being used in the lab, a reminder to use personal protective equipment, how to react in the case if there's any spills of any hazardous material. Of course, never eat or drink in the lab. Unfortunately, that's one of the reasons why we have such strict rules in the lab at school, because we're always subject to inspection. So if you take a look at this, you've probably seen this on many tanker trucks and maybe in some industrial places. In the identification system of the National Fire Protection Association, the white diamond on the label indicates the chemicals. And if you look at flammability, special hazard information, reactivity, or stability, that would deal with special hazard information. If you see an image in a red diamond, that's a fire hazard. Blue diamond, that's a health hazard. So the red diamond, like we said, of the National Fire Protection Association indicates, as we said, flammability, like any type of flammable gas that's used in the office, such as maybe something like ether or any type of place where any of these hazardous chemicals are used. So if you look at this, this is something you definitely want to have access to if you work in any facility that uses hazardous materials. Section 1 on all safety data sheets is required to have which of the following? That would be identification. So according to the Occupational Safety and Health Administration, any facility that uses any type of hazardous chemicals, and that could be something as common as industrial bleach, has to have a list of manufacturer's safety data on each and every product that they're using. And this material safety data sheet is a book of compilation that tells you what the substance is, what its effects on the body are, what immediate first aid treatments should be rendered if you're exposed to it, and what type of follow-up care you should be receiving. So in a physician's office laboratory, which of the following is or are the most common types of hazardous chemicals? And if you take a look at that picture, you probably guessed it right. All of the above. Sodium hypochlorite, which is a common disinfectant for all types of surfaces. Cava wipes and glutaraldehyde, those basically cleanse wipes that that are disposable. Acetone and dyes, these are sometimes used to mix chemical reactions when we're doing maybe those gram stains or other type of procedures. So all of them are correct. You should know that you should never be working with any type of chemical without eye protection, but just on the off chance that you're not and your eye gets exposed, you want to flush it with clean water for at least 15 minutes. And even then, even after that, you want to seek emergency medical care as soon as possible. Uh, Personal remembrance of first day in a new urgent care out in Suffolk, and somebody from a storefront just two storefronts down, working in the warehouse, spilled some type of chemical in his eye, and he, instead of calling 911, he came over to us, and we immediately took him in. We flushed his eye, flushed his eye, flushed his eye. Actually, there was an ophthalmologist just down the block. We ran to the ophthalmologist. He saw him right away, and he said that if he had waited, if we didn't flush the eye the way we did for a good 15, 20 minutes and waited any longer, he probably would have lost a significant amount of vision in his eye. So take that very, very seriously. So chemical safety procedures to be aware of. Never pipette by mouth. Now, I don't think any circumstance where you actually see that anymore. Pipette is like one of those little tiny bulb syringe type thingies that you can pull a little bit of aspirate out of the aliquot and put it on its examining surface and take it out. Sometimes in big industrial labs, they use these. They used to use these pipette mechanisms that you would actually. It was kind of like an old crazy straw with different bends and turns in it, and it was a filter in the middle, and you would actually suck out by mouth to pull the liquid into the chamber. Yeah, if you use one of those, find another job. Work under a fume hood. I mean, you see fume hoods in our labs. I don't really think they're active anymore, but that's if you're handling any hazardous chemicals. Always rinse exposed skin underwater for at least, well, I mean, this textbook says 5 minutes, but really the more the better. Eye wash station for at least 15 minutes, but more importantly, know where the eye wash stations are and make sure that the eye wash themselves are not expired. We had an eye wash station in room 250, the phlebotomy lab, that expired in 2007. Needless to say, I wasn't too happy about that. Keep chemicals tightly sealed and know the hazardous identification symbols. It doesn't make sense to memorize all the symbols, just the chemicals that you're using in your facility. I'm sure everybody knows this sign here, biohazard. The red sign with the three semicircles and a circle in the middle. This indicates that this is a storage container where you have biohazard materials like equipment that's been soaked in body fluids like blood or anything else. And you should know that regular garbage should never be discarded in a biohazard container, because the company has to pay a significant amount of money to have those carted away, and they're carted away by weight. So that's just a matter of wasting resources. So if you look at this, which of the following requires the laboratory employer to have a written exposure control plan to protect the lab's employees? Now, if you were paying attention before, that would be OSHA's, the Occupational Safety Health Administration, Bloodborne Pathogen Standard. OSHA sets the standard for a lot of workplace safety regulations, but the Bloodborne Pathogen Standard deals specifically with the medical facility and staff's potential to be infected by body fluids. Okay, so what is OSHA's bloodborne pathogen standard? As we said before, it's the rules and regulations and policies that this agency has put forth to protect you against accidental body fluid exposure, such as needle stick injuries. And that's always a common concern. Probably more healthcare providers have suffered needle stick injuries than really come forward. It's unfortunate that sometimes they're not reported. But in other words, first thing to do is always position yourself and your equipment to allow easiest access to the specimen. So if you're drawing blood, make sure you're in a position where you have the sharps container readily available to you. And if you need to take out the needle and replace it with another one, make sure it's all within an arm's reach. Plan safe handling and disposal prior to any procedure. So again, that means taking the time to set up your equipment properly, not rushing through it. Make sure everything is easily accessible to you and easily egressable to you, meaning that you can get rid of this used equipment quickly and safely. Use safe and effective needle alternatives when available. That's probably not the easiest thing to do as far as the medical assistant goes, because when it comes to drawing blood and giving injections, well, those options are there. Using needle alternatives really applies more to administering medications and drawing blood out of either peripheral IVs or central IVs, which is not really done. For the most part, it's not done outpatient. It is done inpatient, but that's the job of a certified nurse, not a medical assistant. Activate the device safety features. Now, I'm sure that, remember, maybe a week or two ago, we were practicing injections, and it's very important to you engage that safety device on the needle if you have to dispose of that needle. And please never really do it by hand. And the flip guards one that we used in class, that's just one type of safety device. There are many different on the market. Make sure that you are shown the proper way to use these safety devices when you're being introduced to a new piece of equipment. And of course, immediately dispose of contaminated needles in OSHA compliant sharps disposal containers. Um, Never overfill a sharps container. It may be very tempting to, just get that one last syringe in, but the sharps containers should really be changed when they're about 70 to 80% full. Of course, for-profit corporations are going to want to get the most bang for their buck, but don't put yourself in a situation where you're going to get a needle stick injury. Never try to force a sharp into sharps container. Make sure you don't accidentally drop anything in that sharps container. It's a never thing that can happen. And let's just talk about a minute if you do wind up accidentally getting a finger stick, a needle stick. If it's a needle stick on a clean needle, it's just a matter of soap and water and keeping it clean. If it's a contaminated needle, depart from the patient as soon as practically possible. Thoroughly wash out that site and immediately report it to the supervisor. Don't let embarrassment or shame or fear keep you from getting the compensation protection that you are entitled to. And it also means getting proper medical attention immediately. Most people are afraid of transmission of AIDS. Yes, and that's a valid concern. It's not the easiest transmission in the world, but it's not something that you can say there's zero chance of. To reduce chances, there are medicines available to be prescribed to you that can help lower your chances of seroconverting from the virus floating into your bloodstream to it actually taking hold of your immune system. But the longer delay, the less effective it is. I can't stress the importance enough. Put your fear, put your embarrassment aside, report that injury. And as I said before, never reach into a sharps container. So maybe if you have some jewelry that's kind of loose fitting, maybe you want to take that off and secure it in a safe place prior to doing the procedure that involves you having to handle a sharps container. And remember, if you wind up pricking yourself with a contaminated needle, actually, maybe you want to encourage to bleed out a few drops a little bit to help maybe carry any pathogens away. Wash it thoroughly with plain soap and water. Cover it up to reduce any further infection and protection, and then report it. Please don't fail to do so. Microphone is the most effective method of preventing the spread of infection in laboratory. We learned this way back in the beginning of the semester, and we've re-examined it over and over again, not just here, but in other classes, is to properly wash your hands with warm, not hot, water, soap for at least 30 seconds, making sure that you cover between the fingers, the sides, the backs of the hands, and underneath the fingernails as well, each and every time. So, quantitative versus qualitative laboratory results. So, which of the following would be a qualitative lab results? Well, three of these questions have numeric values. One of them is just yes and no. And if you can figure it out, that would be B, fecal occult blood test, positive or negative. Fecal occult blood test is when you give a patient a little kit. They grab some stool out of the hat after having a bowel movement. They scoop it on these little cards that you see right here. They seal it up, send it back in the sealed bag. It's sent to the laboratory. It's treated with a chemical. If it turns a certain purplish color, that means there's positive blood in the stool. That can't always be seen to the naked eye. Okay, so a qualitative test gives a numeric value that's not attached to the test. It may be used as a screening test. The quantitative test represents the amount or quantity of an analyte. So, for example, glucose, 120 milligrams amount of solute per deciliter of blood. That's just one example. A qualitative test is either positive or negative, like a rapid strep test, rapid mono, rapid influenza slash COVID test. And a quantitative test results expressed as number with units of measure attached. And I just gave you a couple of examples, but there are a couple of examples there at the bottom that you can review as well. So a term used to describe a blood sample in which red blood cells have ruptured is called, if you've taken phlebotomy, you already know this, it's called hemolyzed. And that's why it's important to adhere to proper phlebotomy techniques. Keeping the tourniquet on for no more than a minute or 60 seconds, using the biggest gauge, I should say the smallest gauge, the widest needle that's feasible, practical, so that the red blood cells don't burst when they're entering the collection device, because that can give an abnormal result. We're not going to dwell too much of microscopes in the laboratory because very few instances where the medical assistant is going to actually use a microscope. But just to get familiar with some of the terms, a compound microscope, if you've ever taken microbiology or even basic biology, you should be familiar with this, uses two lens types, the objective lens and the ocular lens, which is the eyepiece, to magnify the image of the specimen. So the ocular typically magnifies by about 10 times, the objective usually about 40 times, although different microscopes can be different. The ocular of the microscope generally magnifies the image, like I said, about 10 times. The microscope component that directs the light up to the slide is called the condenser. So these things are pretty expensive equipment. That's why when you handle them, lab technicians are very, very strict on how you handle them. Always carry them with two hands. Make sure they're not placed towards the edge of the table. The condenser directs light upward through the slide, and the iris of the diaphragm regulates the amount of light passing through the specimen. It's like seeing a slideshow in real time. What is the magnification for an oil immersion microscope objective? Well, that's a little bit more intense. It's about 100 times. The longest objective of oil immersion 100 times. Now, I doubt this is going to be on your exams, but you never know. Follows the finest focusing of an object and requires the use of a special oil that's placed directly on the slide. If you ever go into any setting and they actually use that and expect you to use that, I would love for you to let me know about it because I haven't seen it yet. The special oil called immersion oil prevents the refraction of light, improves the resolution. So less glare, less shadow, more clarity on the view, especially when you're looking at different types of bacteria or different parts of the blood. So microscope have three components: the magnification system, the illumination system, and then the basic framework itself. You see the microscopes in the labs. They're kept in the back cabinets with plastic coverings on them. They should be placed in a permanent location on a sturdy lab where they cannot be bumped. That's not always physically possible. So most lab technicians don't like the microscopes that cost a lot of money having to be put back and taken from site to site. So a lot of times they'll just do it themselves. Centrifuge. If you don't know what a centrifuge is, it's basically a machine that spins a tube of blood round and around at very high velocities for about 15 to 30 minutes, depending on the setting. And anybody know what it's used for? It basically helps separate solids from liquids, blood cells from serum to plasma, and even crystals in the urine. Remember, blood has four major components. It has red blood cells, white blood cells, and platelets, and then it has the plasma. The first three components are called the formed elements, and then the other part is the liquid part, which is the plasma. Crystals from the urine can sometimes actually tell you not only if there's urinary problems, but it can actually tell you if there's problem, or it can tell the practitioner actually that there may be problems in the nephron or the functional unit of the kidney itself. And this is an image of what a typical centrifuge looks like. You'll probably get to see that more in lab. We'll try to get that in phlebotomy class as well. So balancing a centrifuge is kind of important. It requires that all tubes of the load, let's see about, yes, have about the same volume of liquid in each tube, are of equal size and shape, and have a partner directly across in the rotor holder. So if you only have one tube of blood to be centrifuged, you have to counterbalance that with another tube on the complete opposite side. If you ever loaded a washing machine that's a top load and there's a lot of clothes on one side and it's imbalanced, and you've heard that washing machine rumble and bounce around, that's exactly what can happen in a centrifuge. If it's only one tube in it, it's unbalanced, it can rattle, it can shake, and actually fall off the table. And lab technicians generally don't like that. Neither do instructors. So aerosolization, just think about what that word is. Aerosolization in a centrifuge can be prevented by ensuring that the tubes are tightly capped. Now, usually the tubes are already pre-capped by the manufacturers, but it's always good to make sure that the expiration dates are good and the integrity is intact as well. And if you did the reading, which type of specimen must be chilled if testing will not be performed immediately? And that's urine. Okay, so basically urine, if it's left out at room temperature, the composition will change very quickly. So that's why it's generally not recommended for a patient who's pee shy to take a cup home and then bring it back later on, because you may get an invalid result. Incubators used in microbiology laboratory generally maintain a constant temperature. And what do you think would be the best answer? Yeah, about 95 to 98.6 degrees. So general body temperature. What term describes the physical, chemical, and microscopic examination of the urine? That would be typical urinalysis. Again, there's about 8 or 9 different analytes that we can examine in a simple point of care urinalysis just by putting in a little balanced dipstick and either reading the color coordination on the bottle itself or putting it into the mechanical analyzer, which is probably a little specific. If you're colorblind like me, you may have a real time matching up the proper colors on the bottle. The stepwise method used to collect, process, and test a specimen that will be used as evidence in a legal case is called 5, 4, 3, 2, 1. Chain of custody. So, and it may not be in a legal case, it may be for occupational medicine as well. A potential employer or employer may send a potential employee for a drug screening exam where they have to come in and give a urine sample, and there's a very meticulous protocol that occurs. Patient has to fill out the paperwork, show all the proper ID, basically empty out all their pockets, take their jacket off. Before they void into the toilet, they usually have to close off that bathroom, put some actual dye in the toilet water, so toilet water can't be used to taint the sample, so there's no cheating. They have to turn off the faucets, and basically have somebody standing by to basically listen for if there's any type of suspicious activity, in which case uh, the sample will be invalid. Then from that point on, there's a whole series of steps to make sure that that sample has not been tainted, has not been interfered with. Each and every person that takes that sample, from the medical assistant to the courier to the processor in the lab, has to sign a load of paperwork to ensure proper procedure. So when a specimen is evidence in a court case, certain procedures must be followed in collecting and handling. I don't know if you'll ever have the chance to do this. Hopefully not, but that was specifically or especially important when assisting and handling specimens from sexual assault kits. Now, in my emergency medicine days, I did several of them in Lower Manhattan, and just one little misstep will invalidate the whole test, which could be the whole difference between a conviction and an acquittal. Specimen processing must be documented meticulously. So when we say chain of custody, think of it: stepwise method used to collect, process, and test a specimen. And the documentation must be signed by every person who has contact with that specimen, from the collection, from the patient, to the MA, to the courier, to the processor. A term used that indicate the laboratory test should be run immediately. I'm sure you know this term. It's not ASAP. That's not a proper term. It is STAT. STAT. If we need a STAT cardiac enzymes, we need it to be done immediately. If any type of STAT lab has to be done immediately. So generally, if a blood sample has to be done STAT, like checking for cardiac markers for MI, or something like a D-dimer to check for the possibility of a blood clot, they really shouldn't be done in the outpatient setting. I'll give you a little funny story where how bad medicine can be sometimes. I worked in an urgent care in the Bronx. One provider a day. It was me and two other physicians. One was pretty good. One was, I don't know what they were thinking. I'm reviewing the charts and checking out the lab results from prior days, and I come upon this one where the doctor sees a young 14-year-old who needed to be, quote, medically cleared for a possible drug overdose. The context of this possible drug overdose is he went to the school nurse because he wanted to go home, had a really bad toothache, and as such told the nurse that he took about 6 to 8 regular strength Advils. Definitely a higher dosage, potentially dangerous dosage that should be taken, not necessarily a lethal dosage. And there was no indication that this child wanted to harm himself. He just wanted to get rid of his pain. But of course, school systems being what they are, and so many lawyers in the world, they need medical clearance. So in the emergency room, anytime we suspect a drug overdose, the 3 tests we order immediately, or what we call STAT, when somebody's not behaving right, we order alcohol levels to check for, see if that's the case, because that can actually be treated. Tylenol levels, because believe it or not, Tylenol levels, just a little bit of an overdose of Tylenol can be lethal. 20 extra strength Tylenols can shut down the liver and put you into a long, painful death. And salicylate levels, which are aspirin. So it's a very common point of care order in the ER. You get Tylenol, alcohol, salicylate levels. Well, that's in the ER where we get the results back in about an hour and a half, and then we can act immediately upon that. This physician sent out these labs asking for Tylenol, alcohol, and salicylate levels. Don't know what the line of thinking was, because if any of these tests came back abnormal 48 hours after the kid was already sent home, that's just a personal injury lawyer's big fantasy case. So make sure that you're processing the labs appropriately. If the order comes for a stat, it has to be done immediately. Um, Chemical added to a blood sample after collection is to prevent clotting is called a something, an anticoagulant. An anticoagulant. Now there are different types of anticoagulant. EDTA is a very common one. Ethylene, diamine, tetraacetic acid. Now, there's no way I would be able to pronounce that word if I wasn't reading it directly off the slide. So just say EDTA. EDTA, heparin, sodium glycolate. That's just a few examples of the anticoagulants, because there's some tests that we don't want the blood to clot while they're in the test tubes. All right, and that's basically it for now. My apologies for not being there in person. Please review this presentation. Please do the work on Brightspace. The videos that were included in this presentation will be directly uploaded into your learning folder on Brightspace shortly. And if you have any questions on the material, please feel free to email me. I will check my emails periodically. Thank you for your attention.